Hi friends, welcome to the channel The Nurse. Here we are discussing about NIMHANS Nursing Officer exams, memory-based questions and answers. So the exam was conducted on 17th of December 2023. Here we will discuss some memory-based questions. So I have made these questions from the memories of other candidates. So there will be a difference from actual questions. So I have made these questions with some. I have made these questions complete and given for options, and it will helpful for preparing nurses in future. So you can go to the questions. Before that, if you are not subscribed to our channel, please subscribe. Demands memory based questions 2023. First question: which is not a vital sign? Blood pressure, pulse, blood glucose, temperature. Here, correct answer is blood glucose. So vital signs contains blood pressure, pulse, respiratory rate, and temperature. And in there are some research is going on, and pain is also containing under this vital signs. So that is also important parameter to look for. Vital signs are measures of basic physiological functions that indicate the body's essential functions. Blood glucose is not typically considered a vital sign. It is a metabolic parameter. Second question, a nurse assesses which patient first in the emergency? A chronic schizophrenia patient, a patient with a depression complaining of constipation, a patient experiencing acute anxiety, and all of the above. So correct answer is a patient experiencing acute anxiety. So here we know a chronic schizophrenia patient is not an emergency case if unless there is aggressive behavior. Same time, patient with a depression complaining of constipation also not an important case by priority wise, because we can delay the treatment for some times. But in the same case, a patient with suicidal ideation is an emergency case. So that should be you should correlate with the symptoms. Here, the patient experiencing acute anxiety is a priority based important patient, so that patient to be seen first. Acute anxiety may indicate an immediate emotional or physiological crisis, making it a priority for assessment to ensure the patient's safety and well-being. So among other options, acute anxiety to be seen first. Third question, a patient with a suicidal ideation, the nurse must maintain which action? Watchfulness, maintain friendliness, provide emotional support, monitor vital signs closely. So here correct answer is watchfulness. So watchfulness is crucial when a patient expresses suicidal ideation to prevent self-harm. So if patient is having suicidal ideation, there is a high tendency to do some extreme self-harm behaviors. To we need to avoid that situations by keep watching on the patient. Continuous observation is essential to ensure the patient safety. Otherwise, patient will do some harmful actions, even with some needles or anything. If they are getting means, they will do self harm. They will cut their veins or something, neck or something, and they will try to suicide. So, in order to prevent that actions, we need to be watchful. Create a safety plan that includes no suicidal conduct. That is important. If patient comes with suicidal ideation, we need to make a no suicidal contact with the patient. By patient's own handwriting, we need to make a contract. So contact verbally or in writing with the client with this no self-harm and recontract at appropriate intervals. So we should regularly renew the contract. That will reinforce the no suicidal contract. Explain suicide precautions and relevant safety issues to the client and family. So, in order to prevent these suicide actions, we need to avoid the sharp instruments and all from the patient's bedside. Even with the phone charger, also patient may try to strangulate. So, we should avoid that items from the nearby patient side. If a nurse finds an error in a patient's medicines, what is the nurse's next immediate action? Report the error, provide another medication to the patient, communicate to the next staff, assess the patients for adverse effect. Here correct answer is report the error. if an error comes, means we should report the error to immediate supervisor or to the treating physician. Reporting the medication error is the immediate and necessary action to ensure patient safety, and it allows for proper investigation and intervention. So it will help the patient safety also. So we need to report the error, then the physician will take the necessary action to save the patient life. Fifth question, which is not a cyanotic heart disease? Atrial septal defect, tetralogy of Fallot, truncus arteriosus, tricuspid atresia. So here question is not a cyanotic heart disease. So correct answer is first option, atrial septal defect is not a cyanotic heart disease. Atrial septal defect is a congenital heart defect, but it is not typically associated with the cyanosis. That means bluish discoloration of the skin. Examples of acyanotic congenital heart disease includes atrial stenosis, atrial septal defect, patent ductus arteriosus, pulmonic stenosis, ventricular septal defect. These are the examples of acyanotic congenital heart disease. Then sixth question, which statement is true about MRSA? So please comment what is the full form of MRSA. Routine infection control practices only need to prevent the spread. Organism is sensitive to beta-lactam antibiotics. Organism is resistant to beta-lactam antibiotics. MRSA is a virus. So from the option itself, we can understand MRSA is some organisms. So what is the correct answer here? So correct answer here means option C. MRSA is a organism that is resistant to beta-lactam antibiotics. So what are the beta-lactam antibiotics? So we can see from the explanation. MRSA means methicillin resistant Staphylococcus aureus. Methicillin means that is a drug. So methicillin resistant Staphylococcus aureus is a resistant to beta-lactam antibiotics. Beta-lactam antibiotics is a group of antibiotics, mainly methicillin and penicillin derivatives. Examples includes penicillin, cephalosporin, carbapenem, and monobactams. These are the beta-lactam antibiotic examples: penicillin, cephalosporin, carbapenem, and monobactams. Another, it is an easy question. Which term is not related to COVID-19? Isolation, quarantine, daycare isolation, social distancing. Correct answer is daycare isolation is not related to COVID-19. Daycare isolation is a not commonly used term in the context of COVID-19. Isolation, quarantine, and social distancing are more relevant for COVID-19 prevention. Eighth question, when preparing a patient for surgery, which nursing action is not mandatory in the preoperative phase? Ensure all preoperative medications are given to the patient. Ensure the patient has voided urine. Ensure that the patient is maintained NPO, that is nil per oral, nothing by mouth, for at least 6 to 8 hours. Administer pain medications. So in this question, which nursing action is not mandatory? So here correct answer is option D. Administer pain medication preoperatively is not required. So postoperatively administering the pain medication is required. Administering pain medication is not typically a mandatory preoperative nursing action. Pain management is addressed postoperatively based on the patient's need and as prescribed by the healthcare provider. The other options are essential preoperative nursing actions. Ensuring preoperative medications are given, confirming that the patient has voided urine, and maintaining nil per oral status contribute to the patient safety and well-being during the surgical procedures. Then ninth question, sputum microscopy is negative for tubercle bacilli, but the X-ray shows signs of TB. According to RNTCP, what is the next step to confirm the diagnosis? Liquid culture, CBNAT, GenExpert, Mantoux test. Correct answer is CBNAT test. A negative sputum microscopy result does not rule out tuberculosis. Because it is in X-ray it is showing the patches of the tuberculosis. So we need to confirm with another test, that is CBNAT. The next step to confirm the diagnosis as per RNTCP guidelines is to perform CBNAT, that is cartridge-based nucleic acid amplification test. It is we have discussed in our community tab. So the same question is came for exam also. CBNAT is a molecular diagnostic test that detects presence of microbacterium tuberculosis DNA in the sputum. It is a rapid and sensitive test that provides a quicker confirmation of tuberculosis compared to traditional methods like liquid culture. Then the question: schizophrenia patient on haloperidol, nurse should be aware of potential symptom of EPS, respiratory depression, cardiac arrhythmias, hypertension. The major side effect of haloperidol, that is EPS or extrapyramidal symptoms. So this question also we have discussed in our community tab before the exam itself. So those who are checked that questions means they may score the correct answer for during the exams. So we will see the explanation here. Haloperidol, that is an example for antipsychotic medication, typical antipsychotic medication, or first generation antipsychotic medication. Typical or first generation antipsychotic medication. Example is haloperidol. The main side effect of this medication, that is EPS, extrapyramidal symptoms, which includes symptoms like tremors, rigidity, and bradykinesia. These are the extrapyramidal symptoms associated with haloperidol or first generation antipsychotic or typical antipsychotics. Then 11th question: radiology exposure is high in CT and whole body X-ray, ultrasound, MRI, color Doppler study. So here CT and whole body X-ray, the radiation is used as a diagnostic method. In ultrasound, the sound waves is used for diagnosing conditions. MRI, magnetic waves is used for diagnosing diseases. In color Doppler also, sound waves is used for diagnosing the conditions. So radiology exposure is maximum in CT and whole body X-rays. CT or computed tomography and whole body X-ray involves higher radiation exposure compared to other imaging modalities like color Doppler, ultrasound, and MRI. 12th question: anosmia is caused by damage to which cranial nerve? Cranial nerve 1, cranial nerve 5, cranial nerve 7, cranial nerve 10. Correct answer is cranial nerve 1 or olfactory nerve. Anosmia, the loss of the sense of smell, is associated with damage of cranial nerve 1 or olfactory nerve. So first cranial nerve is olfactory nerve. The damage to the olfactory nerve, it will cause loss of the sense of smell. That is anosmia. 13th question: abdominal assessment step order. Inspection, auscultation, percussion, palpation. Palpation, percussion, inspection, auscultation. Auscultation, inspection, palpation, percussion. Percussion, palpation, inspection, auscultation. So here correct answer is first option, inspection, then followed by auscultation, then percussion. Last investigation or assessment is palpation. This sequence follows a logical progression in abdominal assessment, starting with observation or inspection, followed by listening for bowel sounds, then percussion for organ density, and palpation for tenderness or masses. It may reduce the chance of abdominal muscle contraction and helps to do the assessment easily. So that is why inspection, then auscultation, then percussion, last palpation. If we are doing palpation first, means there is a chance of abdominal muscle contraction due to pain or something. So we need to do from inspection, auscultation, percussion, and palpation will be last. Sign of the left heart failure: edema, jugular venous distension, crackles in the lungs, all of the above. So here correct answer is all of the above symptoms are signs of left heart failure, LHF. So please comment what are the signs of right-sided heart failure or congestive heart failure. So there will be different signs for right-sided heart failure and different signs for left-sided heart failure. For left-sided heart failure, here are the signs: edema, jugular venous distension, crackles in the lungs. Left heart failure can manifest with symptoms such as edema, jugular venous distension, and crackles in the lungs. So because left side is pumping into systemic circulation, so if it is not pumping the system blood into systemic circulation, blood will pooled in left side, left atrium, left ventricle, then left atrium, then from left atrium it is not it is pooled means it will go back to lungs. That is why pulmonary edema. Uh, Here NG tube removal procedure. Correct answer is withdraw steadily while pinching the tube. So it will helps to reduce the aspirational risk while removing the food particles going into lungs will be prevented by pinching the NG tube while removing. Removing a nasogastric tube steadily while pinching the tube prevents the sudden release of pressure, reducing the risk of aspiration. Then 16th question, most common cause of secondary Parkinsonism. Drug-induced idiopathic genetic trauma. Drug-induced Parkinsonism is caused by secondary Parkinsonism is caused by drugs, so especially antipsychotic drugs. Secondary Parkinsonism is often caused by medication, especially antipsychotic drugs. Next question also related to Parkinsonism. Parkinsonism is a deficiency of dopamine, acetylcholine, serotonin, GABA. So, which neurotransmitter deficiency is seen in Parkinsonism? Correct answer is dopamine. Parkinsonism disease, Parkinson's disease and Parkinsonism are associated with the deficiency of dopamine in the brain. So, to treat the Parkinsonism, we need to replace the dopamine. So, the drug of choice for Parkinsonism, that is levodopa and carbidopa. That is that will supplement dopamine. 18th question, aim of cognitive behavioral therapy or CBT. Identify unconscious conflicts, modify maladaptive behavior and thought patterns, administer medications, enhance interpersonal relationships. Correct answer is option B, that is the main aim for cognitive behavioral therapy or CBT, that is modify maladaptive behavior and thought patterns. Cognitive behavioral therapy aims to identify and modify maladaptive thoughts and behaviors to improve mental health. So, Bedsore Assessment Scale, that is 19th question, Braden Scale, Glasgow Coma Scale, Barthel Index, Konofsky Performance Scale. So, here correct answer is Braden Scale is used for assessment of bedsore. So, it will give risk factors. The Braden scale is commonly used to assess the risk of developing pressure ulcers or bedsore based on the various factors. So these are the questions related to NIMH related questions. So we have discussed in previous NIMH related questions, these bedsore related questions. So if you are watched that video means you can easily answer. Then 20th question from oncology, injection emission before chemotherapy time, 30 minutes before, same time after chemotherapy as needed during chemotherapy. So correct answer is 30 minutes before starting the chemotherapy. Injection emission or ondansetron, that is helps to prevent the vomiting that usually seen in after chemotherapy. So we need to administer antiemetic drugs 30 minutes before the chemotherapy. Emisset or ondansetron is an antiemetic, is often given approximately 30 minutes before chemotherapy to prevent nausea and vomiting related to chemotherapy. 21st question, which of the following is not a feature of nurse's record? Write with ink, countersigned by doctor, write legibly, avoid overwriting. So correct answer is countersigned by a doctor. It is not a part of nurse's record. A nurse's record is typically not countersigned by a doctor. It is the nurse's responsibility to accurately document patient care. In medicines, LASA stands for. This is also related to NIMH related question. Options are liposomal amphotericin B, limited anterior space access, look-alike, sound-alike, large aortic septal aneurysm. So LASA means look-alike, sound-alike medicines. LASA refers to medication with names that looks or sound similar, leading to a risk of confusion. So look like the same medicines, same color medicine may confuse the nurses while administering it to the patient, or sometimes the similar kind of name will be there. So these are the medicines creating confusion to the nurse. So we need to keep the Lassa medicine separately by proper labeling. Example for Lassa drugs. So here I have given one example, fluoxetine and fluconazole. So it is sound alike medicines, fluoxetine and fluconazole. So it is an example of sound alike. Look alike means there will be similar size, color like medicine will be categorized under look alike medicines. 23rd question. Green Armitage forceps are used for which surgery? Cardiothoracic surgery, obstetrics and gynec surgery, orthopedic surgery, ophthalmic surgery. Correct answer is obstetric and gynec surgeries. Green Armitage is usually used for obstetric and gynec surgeries. Green Armitage. This is the example of green Armitage. It is used for commonly obstetric and gynecological surgeries used to hold the uterus during surgery. It is atraumatic forceps. So it will used to hold the uterus during the surgery. 24th question. Coplic spots are seen in which part of the body? Tongue, palms, eyes, buccal mucosa. Correct answer is buccal mucosa. During measles, coplic spots are main feature of the measles. Coplic spots are small white spots with a bluish white center seen in the on the buccal mucosa and are characteristics of measles. Then another one, this question is also a simple question. Adult CPR ratio 30 is to 15 is to 2, 5 is to 1, 10 is to 1. Correct answer is 30 is to 2. Chest compression to breathe. So while giving CPR, we need to give 30 compressions and then 2 rescue breath. That is the adult CPR ratio. The recommended ratio for adult CPR involves 30 chest compression followed by 2 rescue breath. Then 26th question, it is a repeated questions, lithium therapeutic range 0.1 to 0.5, 0.6 to 1.2, 1.5 to 2.5, 3.0 to 4.0. Correct answer is 0.6 to 1.2. Same like serum creatinine level, lithium therapeutic range also 0.6 to 1.2. The therapeutic range for lithium levels is typically between 0.6 to 1.2 milliequivalent per liter. If it is less than 0.6, it is indicates that ineffective treatment or ineffective dose. If it is more than 1.2, that will leads to toxicity, lithium toxicity. 27th question, best time for breast self-examination or BSE. During ovulation, just before menstruation, after 7 days of menstruation, weekly, once on the same day. So correct answer is after 5 to 7 days of menstruation is the best time for doing breast self-examination. Performing breast self-examination a few days after menstruation, where breast tissue is less tender and lumpy, enhances the effectiveness of the detection of breast cancer. 28th question, accurate diagnosis for breast cancer, mammogram, myelography, MRI, all of the above. Correct answer is mammogram. Mammogram is the accurate diagnosis for breast cancer. So breast biopsy also we can do. So from the options, mammogram is the accurate diagnosis option for breast cancer. Mammography is a standard screening tool for detecting breast cancer, providing detailed images of accurate diagnosis. 29th question, which is not related to COVID-19. So it is already discussed. So that is daycare isolation is not a part of COVID-19 infection. So all other options are used to prevent or prevent the transmission of COVID-19. Daycare isolation is not a common term related to COVID-19. Isolation, quarantine, and social distancing are more relevant concept related to COVID-19. 30th question. During a mental status examination, the psychologist asked a patient to differentiate between a fan and a bulb. What is assessed by the psychologist? Orientation, cognitive ability, judgment, perception. Correct answer here, perception. So asking the patient to differentiate between a fan and a bulb assess their perceptual abilities, specifically their visual and auditory perception. The 31st question, where is the primary temperature regulation center located in the brain? Medulla oblongata, hypothalamus, cerebellum, thalamus. Correct answer is hypothalamus. This question also is a repeated question only. So the candidates, those who are attended the previous questions, means they can answer the question easily. Hypothalamus, a region located at the base of the brain, serves as the primary temperature regulation center. It receives information about the body's temperature and initiate response to maintain homeostasis. 32nd question. In healthcare waste segregation, which type of waste is appropriately designated for disposal in a yellow bin? Human tissues, organs, body parts, and features below the viability period. Plastic containers, glass bottles, used syringes and needles. Correct answer is human tissues, organs, body parts, and features below the viability period are we can segregate into yellow bin. Plastic containers, usually infected plastic containers, will go to yellow bins, and if it is not infected, means we can discard in black color also. Glass bottle, it will be discarded in yellow colored bin, and used syringe and needles will be in white colored puncture proof bottles. All dressings, bandages, and cotton swabs with the body fluids, blood bags, human anatomical waste, body parts are to be discarded in yellow bags. 33rd question. How much population a CHC, community health center, cover? 1,20,000, 20,000, 1,000, 5,000. A CHC cover 1,20,000 population. CHC covers 80,000 population in hilly area and same time 1,20,000 population in plain area. PHC, primary health center, covers 20,000 population in hilly area, 30,000 population in plain area. Same time, sub-center covers 3,000 population in hilly region and 5,000 population in plain land area. 34th question. What is a classic meningeal sign commonly assessed in patients suspected of having meningitis? Kerning signs, Murphy sign, Chostek signs, Babinski sign. So correct answer is Kerning sign. Kerning sign is a meningeal sign used to assess for meningitis. So how if it is positive, Kerning sign is positive when there is resistance and pain in the hamstring when attempting to extend the knee with the hip flexed at a right angle, indicating potential inflammation of the meningitis. So while flexing the hip, the patient is unable to straighten the knee because of severe pain and resistance. So that sign is known as Kerning sign. So one more sign is there, so that you can comment below. So these are the memory based questions related to NIMHANS nursing officer competitive exam that happened on December 17th, 2023. So if you remember more questions, means you can comment below. We can make a second part. So those who are selected for NIMHANS nursing officer, congratulations. I think my previous videos and the community tab questions are more helpful for you for preparing these NIMHANS exams. So we will keep updating the questions for upcoming nursing officer exams also. Please stay tuned. So thank you for watching this video. So if you have any doubt or confusion, means you can comment below. So I will try to solve your doubts. Thank you.